Welcome to the Dr. Carolyn Coker Ross Show, awakening your full potential and expanding your understanding of how to live fully and joyfully by making conscious choices that promote and maintain vitality in all areas of your life. Now here's your host, Dr. Carolyn Coker Ross. Please be sure to listen to this episode in an environment that is safe. Do not listen to this recording while driving a car or operating any kind of machinery.
Welcome to the Vital Life Radio. Today, my special guest is Judy Crane, and our topic is healing trauma and addictions. Judy Crane is a friend and a specialist with over 2 decades of experience working in both residential and outpatient treatment centers. In 2003, she brought her years of specialized training and her distinctive insights on treating trauma and addiction to create the Refuge, a healing place, which is a residential treatment center in Florida. Under her leadership, the Refuge has grown to become one of the most well-known, leaders in treating trauma, PTSD, and addiction. Judy earned her bachelor's at Rutgers, a master's from New York Institute of Technology, and she's a certified addiction professional in Florida, certified sex addiction therapist, certified hypnotist, and the list goes on. So you can see that she really is a specialist in this area. Welcome to the show, Judy.
Oh, thank you, Carolyn, so much. I've been looking forward to this.
Me too. And I hope this isn't too elementary, but I wanted to start with a very simple question. I know that many of my clients who I treat with trauma often feel that their experience isn't bad enough to qualify them for being told that they have trauma. How do you actually define what is trauma?
I think the simplest and most basic answer to that question is trauma is anything that's less than nurturing. And Sharon Whitestrader-Cruz has said that definition. And I so believe in what she's saying. The biggest, most intense trauma that anybody can experience is neglect and abandonment. In spite of all the other things that can happen, all the terrible events, neglect and abandonment probably creates a bigger hole in the soul than almost anything else. And so if we start there, then we can see that all of those pieces that diminish who we believe we are or who we could be, I think absolutely are considered trauma. And so most of us have experienced some level of trauma.
Do different people react to the same traumas differently?
Absolutely. There's a level of resilience that is created, and there's some wonderful experts that tell us that there's this simple thing that happens to someone who has been in a trauma. If some other human being comes up and offers them love, support, connection, touch, kind words, that creates an opportunity to build resilience, even if it's just a little seed of resilience, and people can build on that. But if someone is experiencing that alone, in solitude, in loneliness, without kind words, without support, chances are, if that happens over and over again to them, then their level of resilience is much, much less. And so consequently, as things start happening to them, just a layer after layer of trauma is created. So it's really about that piece of attachment that we have to experience as human beings.
So, because I'm thinking about in my own family, they're just with my sisters who are much younger than I am, and I had a pretty intact, nurturing family when I was coming up, and their experience of the family was quite different. So, in that case, would someone who maybe had a nurturing childhood and then experienced trauma later in life have more ability to deal with the trauma in a less destructive way? Is that what you're saying?
Absolutely. I think that's exactly the case. And I think sometimes, as I'm sitting here, I think sometimes firstborn, probably they, because we are the firstborn, new, exciting. I think the parents have more time to spend with that child. It's still new, and so there's a lot of attention given to that child. I think sometimes we might see that the firstborn has more resilience because of that. And then as more children come along, there's less ability for the parent to be available. Now, I don't know that that's across the board, but I think that that's one of the examples that we could point out.
So are there other characteristics in ourselves or in the type of trauma we experience that could predict how well we'll deal with trauma?
Mm-hmm. I think when we see babies as they're coming into the world, and we can see that there's a certain kind of personality to some babies. Some babies just seem happier, more upbeat, more in tune with being in the world, and there are some babies that are uncomfortable and maybe have some health issues, and so generally speaking, the babies that that have that ability to be to find a place of happiness and joy are going to be much more resilient. So whether that's an innate piece for every human being or not, that would be difficult to say, except I think there is that piece. I think some of us are just born with the ability to be more resilient.
And what about other factors in ourselves, such as, there may be a genetic risk for depression or anxiety. Do those affect our ability to manage when we have a traumatic experience?
Absolutely. And not just the genetic piece of it, but also family history. So if we're coming into a family that's already been experiencing loss and grief, and we come into that place, we're taking on the generational traumas. So we may not even know what's going on, but we're experiencing sometimes guilt and shame and pain and remorse that probably doesn't belong to us. But as we're born into that family, we're taking on the ghosts of the generations past. It's like...
Well, I was wondering about that because, I've had a number of patients with very severe eating disorders who come from families that had trauma during the Holocaust. And it wouldn't have been in their generation, of course, but maybe their grandmother, or grandparents or great aunts or uncles, etc. Is that the kind of trauma that you're talking about as generational?
Absolutely. Absolutely. And I have found working with Holocaust survivors, the children of, that it's much more difficult to help them to find that place that it's not theirs to bear, because there's that innate guilt. The other piece that happens is when we're working with folks here, we may find that our client is having sexual abuse issues, and when we bring the family in and we do the family work with everyone together, we find that the family is telling us finally that they had experienced the same thing. So there is that shadow of generational sexual abuse that might be there, that our clients didn't even know existed, but it was there in the family. So I think, again, it's like the ghosts of the past affect us even without us knowing exactly what it is.
So there's something that's different in those families than in families that haven't experienced any trauma in the past. Exactly.
There's energy. There's a way of coping and dealing that's different from folks and families that have not experienced it. Exactly.
Mm-hmm. Well, another factor I was wondering about is, does the age of the child have anything to do with their later ability to deal with trauma? Like if they had a traumatic experience when they were some kids are even abused when they were preverbal, or if they were young or adolescent. Do those ages tell us anything about how they might deal with trauma?
Absolutely. The younger the trauma, the more difficult it is. And if it's preverbal, it becomes extremely difficult because we're operating from a place where we're trying to help our client to understand and make a different story about what happened, to find some purpose, so to speak. And if they don't even have words for what happened to them at that point, so the memory is difficult for the client to grab hold of. But the earlier the trauma, the more difficult it is to heal, and it just takes a lot more work.
So someone who may have been traumatized when they were preverbal, how would you even know that trauma happened?
Well, it's an interesting thing. In university, I started doing this work. We'll have folks that will come in and say, they have all the signs and symptoms of sexual abuse, all the signs and symptoms of post-traumatic stress disorder, they feel it, they experience it, and they're the way they describe it is, I can't explain it. It's just ick, ick or a yuck. And that, to me, that's very, very clear when that comes up, that there's something preverbal, because that's exactly what happens. They have no word for it. And it's that client telling you, I have no word for it.
So what about when trauma happens in the teenage years? Because there's so much going on in those years. There's the development of sexual behaviors, normal sexuality comes up, the brain growth and all of that. We just have a couple minutes before the break, but I wondered if trauma in adolescence has any special, signs or symptoms.
The one thing that it has for sure is that our folks often get very, very quiet around what happened. They don't usually tell what happened as teenagers, but the behavior changes. You can start to see where addiction takes hold. All of a sudden, they're experimenting. They drop out of their peer group and pick up with other friends, other people who maybe understand them. They become angry and sometimes depressed. Those behaviors are a clear indication that something is wrong. Something's wrong. And I can tell you that when folks come here and all of a sudden they're telling us their life history, and they say, well, and then when I was 12, I had to go on this medication, and I went to see a psychiatrist, and I say, well, what was going on? Well, I was acting out. My parents got upset, so they took me and I said, but yeah, tell me what happened when you were 12. And so often, that's the first time anybody asked them, including the parent. And I can't tell you how often someone will say to me, but, well, that's when I was abused by the camp counselor. Did you ever tell anyone? No. So the behavior is what's being medicated as opposed to determining what event created the behavior. And I think that for a long time, that's where we have failed our adolescents, that we're not asking what is creating that behavior for you, because there is something.
Yeah, I think that's really an important point, especially for parents who may be listening. I know last year I had a male patient who had a very serious suicide attempt, and when I asked him when he first started being depressed, and he said, 15, and I did the same thing you did. I said, well, what happened at age 15? And no one for 20 years had asked them that, despite severe depression, addiction, multiple suicide attempts, and he had been a victim of trauma. So I think that's important for parents to think about when children start acting out. Is it really just them being a teenager, or has something happened? Judy has a history of being able to put into practice successful healing techniques for trauma for many, many years. And her facility, the Refuge, located in Florida, is a residential treatment facility focusing on trauma. So, Judy, before the break, we were talking about some of the effects of trauma on teenagers, and I just wanted to just look at kind of the spectrum of signs and symptoms that maybe even parents can look for to you talked a little bit about teenagers, how they don't necessarily talk about trauma, and the signs there would be the beginning of addictions or changing peer groups, emotional raging or anger. What about for younger children, or what are things that adults can look for to notice if trauma is affecting their lives?
Well, if we're looking at younger children, some of the same pieces. If a child has been just a wonderful child, and all of a sudden he or she is acting out in great anger and throwing tantrums, there's something wrong. Or if they are staring out into space, we call that dissociating. If they are getting very, very quiet when they wouldn't normally be quiet. If they have the signs of depression, they don't really want to play or don't really want to watch television or be a part of, that's something to look into.
Sometimes they also have changes in their eating, don't they?
Yes, changes in eating, changes in sleeping patterns, and that's across the board for all humans that are experiencing trauma. Those signs and symptoms are just they're universal, but maybe experienced a little differently by each age group. But it's really important for us to pay attention to what's going on with our little ones, because we can intervene. We can intervene on traumas, the effects of trauma, if we can pay attention to those signs and symptoms that something's going on. The difficulty with adolescence is that you're also experiencing hormonal changes and the ordinary pieces that go along with becoming an adolescent. So we have to be more alert to that, to what is really going on. One of the other things that we can start paying attention to when we talk about changing eating habits is this is when eating disorders come into play. This is when self-harming behaviors come into play. With self-harming behaviors, it can be very complicated because our children start hiding that. We may not know they're doing it. They'll be wearing long sleeves. They'll be covering up in places where they have cut or burnt. But those are some of the signs and symptoms that there's something else going on.
So if we stick with the idea of children, how does a parent who might suspect their children has been hurt or abused or even bullied, right? Because bullying can be very traumatic too.
That's a huge trauma. I just had a wonderful experience with one of our alumni. We were doing some additional couples work, and she had been in treatment for probably 6 months in the last year, and a lot of that was with us two different times, and so she's had to leave her 4 daughters. Well, her 5-year-old daughter was so upset when she had to come back down for a short period of time, and she said, "Mommy, she was acting. She was raging and being angry, but because we had taught our alumni how to handle this, she sat her down and she said, "I have a feeling that you're angry at me," and she said, "And it's okay. It's okay for you to tell me that you're angry. I want to know. I want to know what's going on and how can I help you?" Simple conversation. And her daughter was able to say, "Mommy, I am angry at you because you were gone and now you're here and I'm afraid for you to go for 2 days." And so they made a little contract, the two of them, that they would call during the whole 2 days and they would talk, and that she would be back at a certain time. And then she was able to say, "I'm not angry, I'm just sad. But it feels like I'm angry. I don't know what to do with it." So just simply being able to give our children permission that it's okay to talk to us. So many of our children are afraid that our reactions will be anger or that we will go and hurt somebody else for hurting them, that they guard us. They guard us from our own feelings and then take it on themselves. So it's about having the conversation.
But it seems that many parents are afraid if they, say that they expect that their child has been harmed, or they just intuitively have a sense that something happened. It seems like many parents are afraid just to ask, did anyone touch you inappropriately? Is there a good way to delve into that if you're a parent?
Well, I think the simplest way that I believe is being able to find a safe environment, a comfortable place, a place where the child feels comfortable, and set the mood. Set the mood that something that you're talking about, something else that's safe, and then talk about, I've been worried about you, I'm concerned, this is what I'm seeing, and this isn't normally how you are. So I'm wondering if this is because something else has happened, that somebody has hurt you, somebody's hurt your feelings, or somebody's bullying you. Open the door to give that child an opportunity. It's a very frightening thing to do. I mean, there are a lot of therapists who are afraid to do that because they're afraid that it's going to open something up that they're not going to be able to deal with. But I can promise this, that what our folks need is someone to listen and love them and really to witness for them.
And not to blame them for
and
what happened.
Not to blame them, and not to get, not to show that anger about what happened. And so, so many children are afraid that if something sexual happened, that dad's going to go out and kill him, and they take that on and they keep the silence for that reason. So,
or many times they've been threatened by a perpetrator. If you tell, I will.
Exactly.
do such and such. Yeah.
And we
so
have to
now,
be able to let them know that, no matter what was said, no matter how, it's okay. I can handle this. I will help you.
Yeah. So when we talk about the signs of trauma in adults, many times it seems that adults don't connect that their sex addiction or their chemical dependency or their eating disorder or gambling may have its root in trauma.
Mm-hmm.
Is that what your experience has been?
That's exactly what my experience is. It's what pulled me into the field of trauma, because I have been very active in the addiction field, and it was very clear. I would see all of these relapses happening all the time and couldn't understand, what was going on. But what was really going on is people, even when they got sober, other things would pop up, like the whack-a-mole game, So they might get sober, but all of a sudden their sexual acting out was happening, or they were gambling, or the eating disorder. When in fact, if there's a core issue like trauma, then what ultimately a human being has to find a way to soothe themselves. And we soothe with these behaviors, because at the moment it feels good. It takes us away from the internal feelings that have been so disturbing. But we will find over and over again that people who are struggling with eating disorders and sex addiction, self-harming behaviors, and gambling, as well as addiction, that there are core issues there. There almost always are. I would say 99% of those are about trauma.
What's interesting is that very few of the patients that I treat with addictions or eating disorders actually connect that to their trauma. It's almost like the trauma is something that happened in the past, and they don't really see that link between them. I'm not quite sure why that is. Do you have a theory about why we don't connect trauma to these behaviors?
I don't know why we don't connect that. I know that that's probably one of the most important things we do, is to connect the dots for our folks. When we get them involved in doing a timeline or a trauma egg, we can very clearly take them back to the first time, for instance, that they purged or became anorexic, and it's like a template. This happened, and so I purged, and I got relief. Or this happened, and I masturbated and got relief. This happened, and I cut, and I got relief. Now, we don't think about that when we're in the process of those behaviors, but when we can take them back in a timeline, it's like an aha moment for our clients. That's when they finally make the connection. They make the connection, and then they can see the pattern and how that's happened throughout their life, how that's worked for them. I always say that people who have the gene for addiction, that for a while are very fortunate, because they have this ability to soothe themselves for a period of time from the trauma. Now, I know that sounds kind of wacky, but the reality is sometimes the addiction has saved that young person in the midst of some trauma. It's given them a place to hide. It always turns on us, however. But we are, as human beings, we are going to find a way to soothe ourselves. That's our role, that's our job, to self-soothe. Our job as clinicians is to help our folks to find healthy ways to self-soothe. And that's a process.
And maybe having an addiction also gives them time to mature in some ways, so that they are able to actually handle the dealing with the trauma. Because it seems that, I know many of my clients, when they were traumatized, they were so young, they really didn't have any other way to take care of themselves other than using food or, alcohol if they're a teenager or something like that. So that seems to be another aspect. And working through your trauma is not an easy process. We have just a minute before the next break, but I just wondered if you can share some of the benefit of your experience of, what it takes to deal with a past trauma.
Well, I can tell you that it takes a long time. Our 28-day programs don't work. It's just insufficient. And I know a longer term in treatment, 90 days a minimum in a residential setting for folks, where there are multiple modalities and really good clinicians who understand trauma. A lot of clinicians do not, and to be fair, they choose not to operate with trauma, and that's very ethical. But to have folks who really understand trauma and have a lot of skill sets is very important. To find a safe and nurturing environment, a place where they can find comfort and trust in the people that are there, where they can find compassion and caring, and that's very important for healing trauma. There are tremendous modalities that really assist our folks, and I think it's imperative to find the right place, the right clinicians, and the right length of stay for you.
Mm-hmm. My guest today is the founder of the Refuge, Judy Crane. And before the break, we were really talking about the process of healing from trauma. And so, Judy, I'd really like to get more of your the benefit of your experience on what trauma resolution actually looks like.
I think that's a great question, Carolyn, because folks want to know, okay, so what's going to happen here, and why do I have to be in treatment for such a long time? Why is this so intense? Ultimately, what trauma resolution looks like is changing the way we perceive what happened. So most of our folks come in and they have been victims and have taken on that energy of being a victim. Our job is to help them to find purpose in their life, to know that in spite of what happened, that believe it or not, there are real blessings that have come from that event. How have you become a better person? How has it changed the way you look at the world? Can you look at the world in a more positive way as a result? Is there somebody that you can help? So just like getting sober and clean in addiction, you find a purpose in your life. It is the same way with trauma resolution. And so I know when people are getting well, when you can see that shift in their attitude and their mood, and you can see that it no longer takes their breath away when they talk about the trauma.
I call that finding your hook back into life, and it's interesting that you see that in trauma work, because that's what I see a lot in my work with eating disorder patients, that when they start talking about getting back into life and what they want to do and, love for their families and all of that, you can see that they're turning the corner.
Yes,
but that's not overnight, right? So before that, there's a lot of other stuff that happens.
A lot of other stuff, but that's exactly it, and that's when, as a clinician, you can just feel that smile coming up on your face because you know it's working. But there are a lot of things that happen. Number one, trauma is visceral, sensory, cellular. It is in our cell level of our body. That's how we experience it. We don't experience it mentally or cognitively at all. We experience it by the energy in our body, the smells that we are taking in, the sounds, the taste, the feelings that happen. And so when we heal, we have to heal through the body first. And ultimately, our folks have to re-experience on some experiential level what happened to them. And we're asking them, Peter Levine does wonderful work with Somatic Experiencing, so we're asking them to help their body get through the trauma to the triumphant piece. And we help our clients get to that place of triumph where they've fought back or they've found a way to re-experience.
To escape or...
Yes, exactly. Escape, re-experience the trauma where they are the victors. And when we can help them do that in many, many ways, telling the story the way it should have turned out, the way it could have turned out, those kinds of things. We do a lot of things like somatic experience and the ropes course and equine therapy, but we also do a lot of psychodrama, a lot of experiential pieces like artwork, and we use music. And our clients, they begin to find joy in their life again, but they have to be able to identify the trauma, tell the story again, and it loses its energy. For most of our folks, they've never told the story till they get here. And so that's part of that whole piece of being able to become the victor in your own story.
So do you have to forgive what happened or forgive the person who hurt you in order to resolve trauma?
No, you don't. You have what has to happen is you have to be able to forgive yourself. Most of our trauma survivors, in spite of the fact that there were perpetrators involved, the biggest struggle for them is that they blame themselves. They almost always blame themselves, even when they know logically and cognitively that that's not the truth. In their soul, they believe that they're responsible, and so that forgiveness has to come from their own heart. One of the things I do is I ask them to bring in pictures of themselves when they were little, and when they look at that picture and I say to them, you were 3 when that happened. That's 3. Can you see that 3 in the picture? Should that child have been guilty for what happened to them? You can see just the change in their face because it finally makes sense, and the relief of being able to let go of their own guilt and shame around what happened because it wasn't theirs to own.
Mm-hmm. So even if you were 13, you were still 13, not 33 or
exactly.
23. Yeah,
exactly.
Okay.
And it's funny, not funny, but Viktor Frankl says that what has to happen for survivors is they have to come to a place where they recognize there's nothing that they can change about this event. There is nothing that can be changed. It happened. It was there. There's nothing that they can do about it. So the only thing that can change is our attitude about it. And it's where we find purpose and meaning for our life. Yeah. And so, that's really what trauma resolution is.
And I think the Buddhists call that radical acceptance. It seems like many people who've experienced trauma keep reliving it, thinking, if only I should have, could have, and they keep kind of trying to fix something that can't be fixed.
Can't be fixed, exactly. Yeah. So that shift in perception, in the big book and in 12-step philosophy, Chuck C. said we need a new pair of glasses. It's that simple. We need a new pair of glasses. We need to look at this in a different way. And when that happens, again, the relief, the body changes. You could just see that change in our folks. And what I love that happens is so many of them decide, well, you know what? I want to help other people who've been through what I've been through.
That's really powerful. Well, we've been talking a lot about, the victims of trauma, but I wondered if you could say a little bit about how families are affected, family members of the person who was victimized are affected.
I can tell you that we really do a lot of intense family work. Our families come and they are experiencing post-traumatic stress disorder almost at the same level of the clients they're bringing in. And their powerlessness over the events, the family hasn't been able to do anything about it or change anything about it, but they're there witnessing the experiences of their loved ones, and they've walked with them through drug addiction and eating disorders and self-harming behaviors. And when they come here with their family members, they're just terrified and lost and hopeless and thinking, just please, one more time, I need the answer. Tell us how to get our family back. And it's painful to watch how the families have been affected. And we talk to them when they call and tell them that, they need as much help as their loved one does. They really do. The family needs to be able to be heard as well.
Yeah, I think that's counterintuitive because many people would think, well, it didn't happen to me. It happened to my daughter or my husband or my wife. Why should I put focus on me? That's selfish.
Mm-hmm.
Why is that family work so important?
Because for our client to get well, the whole family has to change. The whole family. In the midst of all of this, it's incredible to watch, but sometimes our families get sicker. They get sicker as a result of the addict in the family, whatever the addiction is. They start to lose their perspective of their own life. They almost become like hostages in a situation that is essentially not of their own making. But because of their loving care for their loved one, they're trapped in that cycle. And so many times by the time they come to us, the whole family has become very, very sick, enmeshed, or alienated, and they have to be able to change their perspective of what happened as well. I can tell you that if they don't, it doesn't bode well for our clients. Usually, our clients find that they have to remove themselves from their family for a period of time or find some space, unless the family does their own work as well.
Well, we just have a minute before the next break, but I wondered if you could either start the conversation or tell us a little bit about the process of trauma resolution for the families.
Mm-hmm. Well, one of the things that we are doing here at the Refuge, which it just became an absolute necessity, we would have our folks come for Family Week, and the work was intense. But one of the things that the families would say to their loved ones was, here you are, you're there for 90 days, being surrounded by love and care, and yes, you're doing a lot of hard work, but, there you are, and what about me? What about me? And the families have a right to say that. So we started doing 5-day intensives, and they're very intense, and they go from morning to about 7, 8 o'clock at night. And in 5 days, the families do their own work. They do their own work from when they first were born and what happened to them and how that affected the way they operate in life. And I can tell you that families doing that come together much, much better with the folks that are already in treatment. Because the truth is, just as we said before, trauma is generational. And the way we cope with trauma is generational. And so we really need the opportunity to help the families to heal as well. There might be one person in the family that is most affected or appears most affected or who is acting out the most, but the whole family has been incredibly affected. So if the family is willing to do this work, amazing things happen.
So, Judy, we've been talking a lot about the process of trauma treatment, but I wanted to just ask you, what should someone do if they think they need trauma treatment?
Well, certainly you can always call us and we'll help to direct you. However, if I would really invite folks people are so internet savvy now, I would invite folks to go online and look up what trauma treatment there is in the country. It's kind of limited. There are some folks who know how to do it, but to really research. The other piece is, how do you know what kind of treatment you need? Well, if you're functioning and doing okay in your job, but having an overall feeling of unease and uncomfortability, then you might just need, for a period of time, to see a therapist who deals with trauma and to do that work. Unfortunately, that 55-minute hour is not ideal, and it's difficult to open someone up and then be able to send them on their way in 55 minutes. That's one of the reasons intensives are good, and I can tell you that there are many, many places in the country who do those 5 or 6 day intensives, and I would invite you to go online. There are places like On-Site and Karen Foundation.
And also your facility does an intensive.
And our facility. And those 5-day intensives will give you an idea if you're really in a place where the 5 days a couple times a year might work for you and make you, help you to get through some trauma resolution, but still to function in your world if you're functioning. Folks who come to us, generally speaking, are people who have been chronically relapsing, have been in treatment a couple of times, and that's not working. And it's not working because no one's asked them about the trauma. So the folks that come to us are discovering that they can't even operate in the world for whatever reason. They continue.
So those are the ones who need residential treatment.
Yes, exactly. They need residential treatment because they're not functioning for whatever reason. Not functioning. Their addictions are taking over, or for some of our folks that come here, that there's not even what looks like an obvious addiction, but anxiety and depression are overwhelming them to the place where they can no longer work or they can't function in their family. Those are really, really good signs of trauma.
And many people who've had trauma have severe depression and even suicide attempts, correct?
Precisely. That's precisely it. And again, a good thing to recognize is that generally speaking, they're trauma-driven. Yes, there is some organic and clinical depression, but but so often, and I'm finding that more and more, when you're asking someone, when was the first time you got depressed? When was that really overtaking you? you can take them back to a period of time and an event. Same thing with anxiety. And if that's the case, then, and they're not functioning, and that happens to us a lot. We have people who come here that have been CEOs of big companies, but their life has just fallen apart and obviously need to be in treatment, inpatient. So you can kind of measure it there. What I recommend is certainly, come and see us for an intensive, and we'll be able to evaluate that, what would be worthwhile. There's a wonderful site on the internet. It's ITAP. It's a site for sex addiction therapists, but all of those therapists are also really well versed in trauma treatment. So that's a place where you can go to find therapists. I also
why is there that connection between sex addiction and trauma?
Because trauma creates sex addiction.
Okay.
Yeah, and trauma creates eating disorders. So folks who really understand eating disorders usually understand trauma. Folks who understand sex addiction understand trauma. Unfortunately, in the field of substance abuse, that's not the case. It is becoming more and more the case that people are learning and understanding that trauma can be a core piece of addiction. But I think because addiction is genetic, that people believe, that can't correlate. But it does. It does.
Well, in integrative medicine, we believe that you can turn your genes on or off, not always under your control, but it may be that trauma clicks on the addiction gene.
Absolutely. I believe that as well, Carolyn. But again, if you need some help and you need some direction and you're not getting it out there, feel free to call our admissions office. And that's not about coming to the Refuge. That's about us being able to direct you to a place that might be near you or would be more appropriate. And we do that every day. We field a ton of phone calls where we can direct people to the right place. So we'd be happy to do that. I know, families get lost in the mix, and they don't know what to do or how to do it. And so we need to be able to go to the experts to find out what's right.
How has trauma treatment changed over the 2 decades that you've been doing this work?
Well, I can tell you this, that in the 70s and 80s, therapists understood this. We talked about the core issues, and we have some wonderful people in our field who were doing this work in the 70s and 80s. Unfortunately, healthcare had created this terrible vacuum where it needed to be about addiction, and it needed to be 28 days, and all of those pieces were insurance-driven. And so people were no longer, really allowed to go into that work because it was driven by insurance. You wouldn't get paid if you were doing that work. So it got kind of lost for a while. And that's dramatically how it changed. And in the last 15 years, we're looking at it again. Thank heaven, because this is, it's where people were falling through the cracks. So I know that we at the Refuge were one of the first extended care residential treatment centers to do trauma. And we have grown and developed and honed our skills. And I think as a result, and I don't say that with any arrogance or ego, as a result, there are a lot of other programs that are beginning to do the kinds of things that we do, which really have proven to work. Yeah. And like you, the integrative health system is what works.
Yeah. Well, I know you work daily with individuals who have had, really serious and kind of depressing experiences in their lives. How do you keep your spirits up?
Well, I'm a voracious reader of thrillers.
Oh goodness!
So I do that. It takes me away. We are very, very clear with our therapists here that they have to take care of themselves. So we offer yoga and massage for our therapists. I give them a lot of vacation time because it's imperative to prevent burnout. You're right; these stories, they're overwhelming, and I have a staff who are so committed to our clients. They overwork themselves. But I do those things for myself. I make sure that I go away on vacation to an island by myself where nobody knows what I do, and I lay in the sun and get well, and then I come back and I'm all rejuvenated. I make sure I do some really good things for myself.
Yeah, that's really important, isn't it? It's hard to heal others if you're burned out.
Exactly. It's exactly the case.
And it doesn't seem like we're really focusing much on that in other, treatment areas, like addiction counselors often get burned out. I know eating disorder counselors do as well. So
it's really unfortunate because I know that when you're doing this work and then you go home to your own family and you've heard these horrendous stories and your little boy comes up and say, "Joey bullied me today," it's, the immediate response in your brain is that if that's the worst that happens to you, but that's not fair, and it's not okay. And so we have to be able to take care of ourselves so we don't neglect our own.
Yeah, exactly. Well, it has been such a pleasure having you on the show today. I'm sorry to say that we don't have any time left, but I just want to remind people that if you want more information or you need help finding trauma treatment, you can turn to the Refuge, a healing place, at www.therefuge-ahealingplace.com. And Judy, can you give the phone number that they would call?
352-288-3333.
Okay. So I want to thank you, Judy, for being on the show and giving us such great information. And also thank our listeners to The Vital Life, Awakening Your Full Potential. Next week, our guest will be Dr. Neil Barnard, who is the author of Kickstart Your Health. And he'll be talking about ways to kickstart your health, learning about foods to control appetite, how to lose weight, how to improve your energy. So I'm your host, Dr. Carolyn Coker-Ross, and I'll talk to you next week.
You have been listening to the Dr. Carolyn Coker-Ross Show. Please visit CarolynRossMD.com. That's CarolynRossMD.com to access podcasts, show archives, and more about Dr. Ross and her services.